Hello everyone, my name is Dr. Nita and I'm here to talk to you about my show, Time with Dr. Nita. This show basically consists of issues that women we face generally in our day-to-day activities, and then I would like us to talk about them. I would also enlighten us on some of these issues and then ways of how to solve them as well. I'm an obstetrician gynecologist and you're welcome to my show. So, you are ready? Physically, mentally, emotionally, psychologically, and financially to make a baby with your partner. Today we are going to talk about preconception care, a few things you may have to do to ensure that your success of getting pregnant is increased. The first thing you would have to do is to talk to your doctor about it or talk to a physician about it. There's something we call preconception care. Some people have certain medical conditions that may worsen when you get pregnant. Example is hypertension or diabetes mellitus, sickle cell. If you have all these, you have to talk to your doctor about it so that you put all these things under control before you get pregnant. Then there's also the issue of folic acid. UK and USA, the state recommends that every woman of childbearing age takes folic acid 400 micrograms daily. So I would advise that anybody who wants to get pregnant takes folic acid 400 micrograms every day before getting pregnant. It is over the counter, so you can just go to the nearest drugstore and then you get your medication. Before a woman gets pregnant, she needs to live a healthy lifestyle. This will ensure the optimum growth of the baby. First and foremost, your sperms and the eggs. These need to be healthy to form a healthy baby for the onset of a pregnancy. If you are drinking, you need to stop drinking. If you are smoking, you need to stop smoking. Smoking affects the quality of the eggs that will be produced by the woman, such that even when there's fertilization, this zygote that will be formed will not be a proper one, so it may abort somewhere along the line. So you will need to stop your smoking. And then if you are on any recreational drugs such as cocaine, such as heroin, you may need to stop all these as well. You also need to increase your intake of fruits and vegetables. Fruits especially contain a lot of antioxidants, and these antioxidants help in the proper formation of the eggs and the sperms, so that when they meet and they come together, they will be able to form a healthy baby. You will also need to eat a lot of lean meats. You need to eat a lot of healthy dairy. If you need to take in milk, you can take the low-fat ones instead of the full cream ones. And then also you need to eat a lot of grains, rice, barley, wheat, to increase your chances of getting pregnant. Another important thing that you need to consider if you want to get pregnant is your weight. If you are overweight, you may need to lose a little bit of weight. If you are too thin, you may need to increase your weight. It's been found out, studies have shown that weights of less than 50 kilograms have an adverse effect on the ability to get pregnant, because if a woman is too underweight, even ovulation becomes a problem. If you are overweight, what happens is that the excess adipose in your body will be turned into something we call estrogen, which is a hormone in the woman's body, and this estrogen affects your ability to ovulate as well. So you need to keep a healthy BMI in order to increase your chances of getting pregnant. And then you also need to reduce your stress in your life. Sometimes you may need to go for a vacation, sometimes you may need to do yoga exercises, sometimes even just going to the beach to go and relax for a couple of hours will be enough to reduce your stress levels. And then also for women or men who exercise, it's advisable that you do not over-exercise. Too much exercise in a woman will affect her ovulation as well, and this will affect your pregnancy. And then for the men, it's advisable that you wear cotton briefs or airy underwear. When the underwear is too tight, the area around that side becomes too warm, and it affects the sperm production as well. And then also women should be aware that after 35 years, your chances of getting pregnant goes down very fast. So in case you need to get pregnant, you may need to do it earlier than 35 years. In summary, these are a few of the things that you need to do to increase your chances of getting pregnant. Before you get pregnant, you have to know that there's something called preconception care. You see your doctor to sort out any medical issues. You take your folic acid every day. And then also you have the healthy lifestyle. You stop smoking, you stop drinking, you stop drugs. You live a healthy lifestyle. You eat fruits and vegetables. You maintain an adequate amount of weight. You also need to know when your cycle is, because for women it's just a small period of time within which we are fertile. And then when you know your fertile period, you should be able to tell when you are ovulating. And then there are also a few precautions that you may need to do. Realize that women, as we age, our fertility declines, so you may need to see your doctor to talk to about your fertility. Thank you.